Dr. Roberts, are you, can you hear me? I just turned on the recording, so I just wanted to make sure you guys could hear me. Can everybody hear me?
Yes.
Okay, Victoria and Marilyn, are you there? Can you hear me?
Yes.
Okay, Victoria, can you hear me? Victoria, are you available? Victoria, are you available? Okay, let's see here. Victoria is raising her hand. Okay, Watkins says they can hear. Okay, great. Okay. All right, guys, the recording has started. So first of all, I want to thank you guys for coming on. And I'm going to turn my screen around so you can actually see me. I wanted to have this session available so that you guys could answer or could ask any additional questions on any information that's coming up on our next exam, those concepts that we've discussed thus far. I know Dr. Roberts covered heart failure on last week, and we've also covered hypertension, acute coronary syndrome, where we did the stent making in class, and then we've also covered cardiac procedures. There will be some eye and ear questions on there as well, and you guys should have your pink sheets that I gave you on Tuesday in class with the breakdown of the content. So I've got some more people wanting to join the room here. I'm just going to add people as they come on, if that's okay with you guys. I want to go ahead and open the floor up. I want to go ahead and open the floor up to anyone that would like to ask a question. So if you've got a question, you can go ahead and unmute yourself, and Dr. Roberts and I will try to answer the question for you. Antoinette, did you want to start?
So I actually don't have a specific question. I was here just for any knowledge that I might pick up while I was in the meeting. So I don't really have a certain question.
Okay.
And I am a return student this semester, so I'm just trying to grab anything I can. So
okay, great. So the thing is, the cardiac information, this should be probably one of the more easier chapters that you guys have out of your 4 exams, just because all of the information kind of ties in together. Make sure you review your ATI book. I didn't go over that information specifically in class, but care of the patient post-op stent placement, it's going to be some definite information that ATI stress, knowing your risk factors. Those things are kind of going to go hand to hand with the acute coronary syndrome as well as hypertension. Marilyn, did you have any concepts that you wanted to discuss?
No, ma'am. I'm in the same. I'm here for the same reason as Antoinette.
Okay. And I've got Victoria. She's the only other person that's available. Victoria, did you have any concepts that you wanted to cover, or anything that you didn't feel comfortable with thus far on the information that has been presented? Victoria? I think she raised her hand, so I'm not sure if she's got audio. Oh, okay, she said her mic isn't working. Isn't working. Okay, let me text her back. Okay. Okay. For your eyes and ears content, I would definitely make sure you review the PowerPoints and the recorded PowerPoints, because I did discuss in great detail different medications that are used, those major illnesses dealing with cataracts, glaucoma, retinal detachment. I would make sure that you have a good grasp of that information. Dr. Roberts, did you have anything additional or anything that you wanted to say?
Can you hear me?
Yes, ma'am.
Okay, perfect. So nothing really specific. I think that we drove heart failure down into the ground Tuesday. So hopefully you guys are so sick of heart failure that whatever you see that you'll be familiar with it. Just like she said, this is the easiest content that you guys will take a test on. So I would really try to knock this out the park. Make sure you're listening to our lectures. Make sure that you're, once you've read the book, make sure you're looking at ATI for those key concepts. You guys can do the Dr. Tea Time with Dr. Roberts. That's 5 extra questions. Remember, the more questions that you answer on this content, the more confident you'll be with it. So I have those 5 questions. Once you feel absolutely comfortable with heart failure, go through those questions and you should be able to answer them pretty easily.
Okay, and they know where to access that information, Dr. Roberts.
Yeah, so Tea Time with Dr. Roberts is right up under all your content for heart failure. So up under the audio PowerPoint, the regular PowerPoints, all that, Tea Time with Dr. Roberts is just a quiz right up under your heart failure content.
Okay, great. I know, just kind of going back with the different classes of antihypertensives, I would make sure that the different classes and how they worked on the system, the different stages of hypertension as well. We did discuss in great length the different classes of medication. We talked about risk factors. So those would be some things that would be really, really good for you guys to practice. ATI has about 5 or 6 questions. They have about 5 or 6 questions at the end of the section. I would make sure I would review that information in ATI, and then make sure you kind of understand the rationales, because those were some really good topics that they cover. And then, like I said, they have the questions at the end, and they also have the rationales listed with them. With hypertension, I would be able to make sure that I could use the nursing process. Of course, that's assessment, implementation, having therapeutic communication with the client. Those are some questions that you'll probably need to make sure that you're able to discuss health promotion goals for the client that may smoke, the DASH diet, that Mediterranean diet. Make sure that you understand those key concepts. We talked about on our pop quiz. You guys still actually have that pop quiz that was given to you. I would review those concepts. A lot of you guys missed the concept about the first line of medications that will be prescribed. Several of you put beta blockers, but it's actually the thiazide. So make sure you have a good grip on providing education to the client who's taking a hydrochlorothiazide, that new medication, whether those are going to be like potassium sparing or potassium wasting type drugs. Just make sure you have a really, really good understanding of that. We didn't talk so much about chemistry. We just kind of talked about those cardiac procedures, but do remember when you're prescribing these antihypertensive medications, that your liver levels can sometimes be affected, especially if you are on a anti-hyperlipidemic medication. If you're on those certain thiazides, of course, your potassium level can be affected. And of course, that, goes hand in hand with the renal levels as well. So make sure that you have a good grasp of that information pertaining to hypertension and those prescribing of medications. Lasix is a big one that we really, really see with the patient that has hypertension as well. We kind of ran over those beta blockers. I would just make sure I have a good understanding of those law drugs to make sure that your patient understands the teaching that you're going to give to that patient. So I think that's pretty much it for hypertension. As far as
I think that you have a question in the chat about risk factors that will make a patient be admitted with chest pain versus not being admitted for chest pain.
Okay, so that's something we covered. We covered those diagnostic cardiac diagnostic tests. We talked about STEMI versus non-STEMI, and what's going on in the nursing interventions that we're going to do for that patient. I'm just going to pull up some acute coronary stuff. Does anybody have any questions about the content that I just kind of ran over real quickly? Coronary syndrome, about hypertension, and some of the key concepts that you need to be able to teach your patient that may been prescribed a medication for their hypertension. Any questions on that? I think everybody is listening. Just look real quick. Yes, something else real quick. I wanted to just touch real briefly on stent placement and the care of the patient who's had a stent placement of the patient who's had a stent. And it's not pulling up anything. Give me 1 second. Down. That one. Looking at my ATI content. Roberts, give me 1 second.
Okay, no problem. While you are looking that up, I just want to let the students know at this point, you guys should feel very confident with this information. Make sure that you're looking at this stuff before class and make sure that you're really participating in class. And then after class, make sure you're reviewing it. If you're only looking at this information a day or two before the exam, you're really not going to be able to grasp it, because our questions are not just general questions. It's going to be questions that are building on what you already know. So make sure that you really have a good grasp on this information, y'all.
I was gonna just say something real quick about chest pain. We talked about chest pain till the cows come home. I believe when we talked about the different diagnostic procedures, that troponin enzyme, make sure you have a good grasp of what it is, how it's released, if there's injury to that myocardial muscles, those levels. I'm not going to be specific as to how long they should be elevated in the bloodstream, but you should know that it is a protein when there's damage that appears in the bloodstream when there's damage to the heart. So I would just make sure that you familiarize yourselves with those cardiac diagnostic procedures, and that you have a good handle on that information. I think that's about the most that I can give. I know you presented your information. Dr. Roberts does have those questions available under the content under heart failure for your own knowledge and your own foundational base. I do encourage you to do those questions to make sure that you've got a good handle on that information as well. All righty, guys. If there's nothing else, it didn't last that long. It's about, well, I've got about 18 minutes, well, 19 minutes in recording. So if you have anything further, or you thought of something after we end this meeting, you can certainly email me or Dr. Roberts, and we'd be more than happy to assist you with that particular concept. Well, I appreciate you guys coming on so much. Thank you, Ms. Watkins. I got your message. I hope this information was helpful for you. Please make sure you review your ATI. I cannot stress that enough. ATI has pulled out the most important concepts from the chapter, and this is this foundational knowledge. Okay, we can't teach everything, but they pulled it out, what you need to know. So please make sure you review your ATI. You guys have a workbook to use. Go through those questions in the back, go through those concepts that they pulled out, because you will see them again. I can promise you that. I can promise you that. Well, Dr. Roberts, I'm going to go ahead and end the meeting if that's okay with you, if you don't have anything further.
No, you guys have a great afternoon.
All right. Thank you guys so much. We appreciate you. All right. Bye-bye.